Hi, I'm Sheila Punayo. I'm now to perform a range of motion. Range of motion is exercise that performed by patient himself or by a nurse in case of helpless patients to mobilize all joints through their full range. Range of motion exercise are those in which a joint is moved through its full range of motions according to its capacity. The purposes of range of motions is to increase muscle strength and endurance, to maintain normal physiological function, to prevent complication caused by immobility like contractures, to improve patients' participation in activities of daily living, to improve physical activities, to increase joint flexibility. There are two types of range of motion: active, done of patient himself; passive, done with help of assistance from another person. Start providing range of motion from head to downward. For neck, move head through flexion, extension, lateral, rotation, hypertension. Movement of head is contraindicated in supine surgery, spine trauma, and patient having central vein line. For trunk, flexion, extension, hyperextension, lateral flexion, rotation. Close door and or put screen to maintain privacy. Perform hand hygiene and wear disposable gloves if possible to prevent the spread of infection. Good morning, Leo. I'm Sheila Ponayo. I'm your caregiver today. Today I'm going to help you in a range of motion exercises. Is that okay for you? We're going to start the shoulder exercises. Flexion and extension of the upper arm. Roll the client to the side. Do hyperextension. We're going to do abduction, adduction, abduction, adduction. Next, we'll do the rotation of the shoulder. Outward rotation and inward rotation. Outward rotation and inward rotation. Make sure that the upper arm at a 90 degrees angle from the body. For the elbow, flexion, extension. Flexion, extension. Also, we'll do supination and pronation. Supination, pronation. I'll start with flexion, extension, and hyperextension, flexion, extension, and hyperextension. Radial flexion on reflection. Radial flexion on reflection. For thumb, abduction, adduction. Abduction, adduction. Flexion, extension. Flexion, extension. And also, do opposition to the little finger. Now we will work the fingers. Abduction, adduction. Abduction, adduction. And we'll work each finger individually. Now we're going to fingers, going to flexion and extension. Flexion and extension. Now I will expose in your one leg and we'll start by working the hip. Now we're going to flexion and extension. Flexion and extension. adduction, abduction, abduction, adduction. Outward rotation, inward rotation, outward rotation, inward rotation. Now we work the knee. Flexion, extension, flexion, extension. Now we move to the ankle. Plantar flexion, dorsal flexion. Plantar flexion, dorsal flexion. Inward rotation, outward rotation. Inward rotation, outward rotation. Now we work to the toes. Abduction, adduction. Abduction, adduction. And work toe individually. Do the flexion and extension. Flexion and extension. Flexion and extension. And reposition and comfort for the client. Perform hand hygiene to prevent the spread of infection. Document and sign the records. Documentation provides ongoing data collection. Giving signature maintain professional accountability. Report any findings to senior staff to provide continuity of care.